Kenya is home to over 2 million individuals grappling with epilepsy, a condition that casts its impact on more than 15 million people nationwide. The International Bureau for Epilepsy has reported that a staggering 75% of those affected by epilepsy find themselves in the rural Africa. Despite these challenges, a handful of courageous organizations within Kenya have joined forces to champion a transformative agenda. Their collective mission revolves around placing individuals with epilepsy at the forefront of adoption and execution of global intersectoral action plan targeting epilepsy and other neurological disorders. In a commendable departure from traditional approaches, these organizations are committed to cultivating a human-centric perspective. They recognize the significance of integrating the voices and experiences of those directly affected by epilepsy in shaping policies and interventions. This approach follows a bottom-up strategy that prioritizes sustainable solutions anchored in the principles of inclusion, equality, diversity, and accessibility. By placing the interests of individuals with epilepsy at the core of their initiatives, these organizations aim to create a more comprehensive and responsive framework for addressing the multifaceted challenges posed by epilepsy in Kenya. Through collaboration and a commitment to human-centric values, they aspire to build a society where epilepsy is not only a medical condition, but a nuanced aspect of diverse human experiences.
This year, hospital admissions have surged by over 2,000 patients in the county, particularly in Kitutu South Sub-County, have notably risen. The effectiveness of our strategy, elevating the area from ground zero, is attributed to the success of our stigma reduction strategy.
There also exist several clinics across the country which we are aware of, and we interact with those who run those clinics closely to ensure the quality of persons with epilepsy in terms of medication, in terms of social life, in terms of economic is adhered to, and we try as much as possible to ensure their rights are taken care of. In their rights and lobby, we have this petition program where we collect signatures to petition the government to make epilepsy affordable for all persons living with epilepsy. Our activities range from even taking the youth through the psychosocial activities like yoga sessions, having interactive forums for the youth where they discuss various topics that affect persons with epilepsy in what we call the Sikika sessions. Sikika basically means to be heard. We also engage them in activities like the picnics for ensuring their socialization, which most of them were denied at a young age, has come back to life, and they get to realize that they can play, they can work, they can read, and they can excel in life.
My name is Becca Mouma. I work at Youth on the Move as a psychosocial trainer of this young person with epilepsy. I guide them in understanding their condition, understanding the ignorance that is attached to their condition, and through that they get the facts, knowing what it is, how to manage it, acknowledging it, and thus they're able to live a quality life as any other person in the society.
I am a beneficiary of Youth on the Move. I live with epilepsy and I'm happy. I contribute to quality life by training youths with epilepsy on computer skills and the current technology, so that they can also interact and live a normal life like any other person.
I'm Helen Alani. I contribute to the quality of life of young people with epilepsy. I take them through yoga sessions, through picnics, and through socialization.
Our other activity is climate smart. We do food security and environmental conservation. Our other activity is education. We support vulnerable children to attain education, and I'm a beneficiary of that. We make sure they go to school to the level that they can manage.
This achievement is closely tied to our programs promoting climate smart, utilizing art for social change and education. We are aiming to plant 50 million trees to symbolize people with epilepsy globally. The active engagement of youth and children has played a pivotal role in contributing to our success.
Since we started the organization, more than 100 people living with epilepsy have gone through the tailoring program. 50 women have gone through the beauty program. 20 young men have gone through the carpentry program, and most of them are employing their own selves because now they started their own small jobs, and some of them are being employed. And this has helped them to be able to buy their own medications and be able to live a good life, an independent life. The future of the Kisrem Epilepsy Foundation is one, to help reduce stigma in Kiambu County and also Githurai. And also another thing that we want to do is also to empower as many people living with epilepsy and also disabilities, so that they could sustain themselves, they could work, they could find employment, or they could be employed. And that's why we decided to form a consortium with other organizations, the Joint Epilepsy Foundation, and we decided to put all our strengths together, and with this, it will help us reach more people in our communities, because we are different organizations based in different areas.
Collaborating as a consortium not only fosters a sense of unity, but also elevates unhealthy competition, placing individuals with epilepsy at the core of our collective efforts. Achieving sustainable development while successfully adopting and implementing intersectoral global action plan on epilepsy and other neurological disorders requires a collective approach, bringing together diverse stakeholders in epilepsy community. By pooling resources, expertise, and insights, we can develop grassroots solutions that address the unique needs of individuals with epilepsy and reduce epilepsy stigma. The collaborative synergy not only enhances the effectiveness of our initiatives, but also ensures that strategies implemented are comprehensive and sustainable. Together as a united front, we can make a lasting impact and create positive change for those with epilepsy.
Joint Epilepsy Foundation Kenya is a consortium of a number of organizations working in epilepsy care in Kenya, with the aim of implementing IGAP, contributing to enhancing the objective of quality life, awareness, treatment, and management. These organizations realize that on their own, they cannot make it. As much as epilepsy's color is purple, epilepsy is indeed a coat of many colors, especially in terms of myths and misconceptions, cultural understanding, causes of epilepsy, and triggering factors. You may find one person presenting an epilepsy attack very different from the following attack that may come to the same person. And therefore, these organizations felt to pool their expertise and their experiences on the ground to form this consortium.
Mwana wena